Hello, I'm Brad Daniel. We're going to talk a little bit about the U.S. healthcare system in this course. The U.S. health, you may have heard people say the healthcare system, really isn't a system, that it's kind of something that's just evolved. And, in many ways that's true. The purpose of this course is to walk through sort of the history and policy issues that have occurred over probably about the last 200 years in the United States and what's led to what is currently the U.S. healthcare system. You know, Systems aren't perfect, so I guess we would most people would tell you it is a system. It's just a system that has issues, and so we're here to get some better context for that. I mentioned my name is Brad. I'm a healthcare administrator. I've been working in healthcare really since the early 90s when I started volunteering in the emergency room, and I just couldn't stop trying to help make things better. I hope you all have the same intent and are probably already working in healthcare. What's great about this course is it's something that will touch you no matter what aspect of healthcare you're involved in, okay, or what your professional goals are. We all need to have a deeper appreciation for how things have evolved and where we think they're going to go, and we all have a hand in making things better as they further develop. So I've worked in hospitals, I've worked in insurance, I have worked in hospice care, delivery. I've basically I've been involved in efforts to help older adults with their healthcare access. So there's nothing in this book that I haven't actually worked in. So it'll be kind of hard to pull the wool over my eyes, so to speak. But then again, I have a deep appreciation for passion that you may have developing. And I'm sure that you can find something in this course that will interest you, especially as you go to write papers and to move forward. You'll need the book. First things first, you'll need the book. We're currently using the 4th edition. The tests are based on the 4th edition. However, the content between the 3rd and the 4th edition is fairly close. So if you can get your hands on an older copy, you'll probably be fine. You'll need to really stay on your toes as we get towards the end of the course, particularly the last couple chapters, but you'll be fine. So if you have any further questions about that, let me know. The course, if you open up your textbook when you get one, it kind of starts out with a little bit of a conceptual history of how things historically developed in the United States. And then we move into how healthcare professionals and providers, you may not be aware some of the history of how physicians and medical training, as well as dentists, pharmacists, nurses, all the things that we learn at Jefferson, all these professionals, how they've evolved. We're going to touch on them very briefly. We're going to talk about technology, financing, and insurance, outpatient versus hospital, managed care, long-term care, and then towards the end we get into really the interesting challenges of healthcare access, quality, and cost. And I think very important that we all kind of understand that we still have a lot to do as far as healthcare equity and access goes. So let's talk a little bit about the content of the course. It's a little bit of a classic course. We're going to have a midterm. The midterm is going to be due on October 2nd. No exceptions. October 2nd. Put that on your calendar. It'll be an electronic midterm. Be very straightforward. It's a little bit early because we're trying to get midterm grades in to fit the Jefferson calendar. Okay, the good news is you do your work early in this course, you're going to have a nice Thanksgiving break and you'll be done well in time for the end of the semester. The paper topic is going to be approved on October 16th. You will write a policy paper in this course about any of the topics in this book. So when you get your book, go to the table of contents, maybe wait a couple weeks, see how the lectures are going, see what you're passionate about, and then pick something that's within the context of this course. If you're taking a class on how to be an EMT and there's an issue with response times of ambulances, that's a little bit afield of this course. Yes, EMT is part of the healthcare system, but I'm pretty good at knowing when you're trying to use a paper for 2 classes and it doesn't serve you well. I want you to pick something here that has more of a policy angle. It could be within your field or your subfield or profession, but I want it to relate to the overall content of the course, and so do the administrators at the school. So the paper is due on November 6th, and the exam will be on December 1st. Okay, the exam will cover the second half of the course. The midterm will cover the first half. It's basically, and you'll have the lectures. So you have electronic lectures you can download from the book, as well as my voiceovers, which I hope you'll find helpful. One of the reasons you're paying for a course where you have an instructor is because you want to get the nuance of having someone who's actually worked in the field in those topics. So you do, I mean, could you read the book and just take the test? You might be able to. I don't think you'll do as well. I don't think you're gonna be doing yourself a disservice. Okay, so take the time to listen to the lectures. Listen to what I'm emphasizing. That's kind of like your secret key to doing well. People always tend to do well in this course as long as they put in the work. I think this is one of those courses that hopefully you'll be thinking about for a long time. It's more of a macro. I want to get into your subconscious. I want you to be thinking as you're going to work all week, how does this relate to what we were just talking about in the lecture? It's going to be less of a class, say like accounting or nursing skills, where you have to really bone up on memorizing skills, and more of a, let's make sure it's sinking in. Let's make sure you're getting the magnitude of this, of what it really has taken for us to get from where we were to where we are today. Okay, I want your papers to be thoughtful. I think I've said that. I want it to be interesting. Keep in mind, I may be grading 30 of them, so that's one of the reasons I like to have paper topics approved. I will try to distribute your ideas. Usually that works. I don't want to read 10 papers on hospice or 10 papers on anything else, even if it's my favorite topic. So let's try to make it interesting, make it something you're passionate about, and let your passion show. So use the syllabus, and we'll be spending most of our time on Blackboard from here on out. I will be logging in a couple times a week to remind you of deadlines, to kind of get you pumped up about what we're doing each week. If you have any questions, let me know. And with that, I hope you enjoy the course, and good luck with everything that you're doing. Thanks.